Yes, good afternoon. My name is Jan Brad, and I am a registered nurse and vice president of Skyline Family Practice in Front Royal, Virginia. And today I will be speaking about the use of our patient info update sheet template and the pre-visit planning. I want to tell you first a little bit about where we're from. Our practice is Skyline Family Practice, and we're located in Front Royal, Virginia, which is about 70 miles west of Washington, D.C., at the foothill of the Shenandoah National Park on the Skyline Drive. Our practice was established in 1993. We actually opened after registering about 500 patients in April of 1994. What was unique about our practice at that time is we went live with practice partner records and appointment scheduling and billing. And we were the only ones even separate from the hospital that was doing all electronic medical records. We have 3 physicians, Dr. Brad, Dr. Barbara Bernard, and Dr. Bernard Pagas. We have 12 staff, which are full and part-time. We've been a member of the PPR Net since the inception in 1995, and that's for Practice Partner Research Network out of the University of South Carolina. The Medical University. We received, finally, after many years of attempts to obtain it, we received our High Performance Award at the PPR Net meeting in 2012 in Charleston. This is a picture of our family at our daughter's wedding, and we have 2 sons and 2 daughters, and we are a true family practice in that every one of our children have worked in some capacity at our practice. Our son, Aaron, on the left, has been very instrumental with the patient's medical update sheets, and our daughter is an operating room nurse that got married, who's worked with us for a short while, and our other daughter, holding our blonde-headed grandson, Erica, is a registered nurse in the emergency room. Our daughter-in-law, who's expecting, is a physician assistant, and our son is in business on the end. This is our group here, and we truly are a real family practice. One thing that's different about us is that we have kept most of our employees, and everyone really makes an attempt to get on board and try to take the best care of our patients and treat them like a family. We have a practice partner, a practice administrator, front office manager. I'm the nursing manager, and we have 5 nurses, and several of our employees are also nursing assistants that work up front and can help us. So the reason that I was asked to speak on this, and it's something that's very important, is the pre-visit planning. And the way that we've accomplished a lot of this is by using our patient information update sheet, which is what this talk is about today. Using IT and process improvement to enable better clinical outcomes. The patient info update enhances the clinical outcomes through patient engagement and through education. So you ask, what is pre-visit planning? Well, pre-visit planning is a process that ensures that the physician, your nurse practitioner, your physician assistant, your staff, and your patient are all prepared for the patient visit. The NCQA's Patient-Centered Medical Home, the PCMH 2011 standards, the number 3, where you plan and manage care, which qualifies for 17 points. The practice systematically identifies individual patients and plans, manages and coordinates their care based on their condition and needs on evidence-based guidelines. So with the pre-visit planning under the care management section, part of it that you'll see here is that you will conduct pre-visit preparations. Pre-visit planning has 5 key elements of pre-visit planning. The first one is medications list updates, refill protocols that are established and followed, and recent labs and imaging that have been captured, care coordination activities completed, standing orders based on evidence-based guidelines, being preventative with wellness and chronic disease management, and this is from the Transfer Med. So, how is the pre-visit planning done? The nurse or a medical assistant will call the patient usually about 5 to 10 days prior to their appointment. The type of the patient that you're looking at for calling are patients that are complex chronic disease patients. The pre-visit planning tool is used, and we use the patient info update sheet, where your health maintenance is reviewed, and it's reviewed with your patient. You also go over the visit expectations. The interaction is documented, and we document this into phone calls with the review of the info and the review of the procedures that will be done, and also the patient's response to this. So you might ask with pre-visit planning, well, why is pre-visit planning important? Well, one of the main things it does is it closes the loop during the appointment. Follow-up on referrals, outside procedures, and prescriptions are taken care of. The clinician at the appointment time can then focus on the current problems. The view of patient state before the appointment known. And you have engagement with shared decision-making, and we use the patient info update sheet for this. You have improved efficiency. You've reviewed the information and the patient's concerns. Your health maintenance is reviewed with your patients, and, of course, standing orders always help. So you might ask, how did you come up with this patient info update sheet? How did it come to be? Well, as you can see by this cute little picture here, it's been a collaborative effort over time, and we've also been involved, like I said earlier, with the Practice Partner Research Network, which was very instrumental with this. The history of the patient information update sheet. This was a version of this was conceived by the Plymouth family practice, Dr. Mary Ehrenberg and Dr. George Schroeder. And the concept was to create a way at that time for patients to see their medications and allow the patients to see overdue health maintenance. This was done by creating a letter template using insert codes for medications and letter codes shared at the PPRnet meeting. Skyline Family Practice, we developed this patient information update sheet because we participated with our practice with the MS TRIP, the #1, the first study, which was medication safety, translating research into practice in 2007. This was a 3-year study, and we were trying to use this tool to go through the medications to make sure everything was updated, and with us being a family practice, anyone coming from a cardiologist or seeing other physicians, that we had the current and updated medications, any changes, so that we practice good medication safety with our patients. And since that time that the information update sheet was developed, we have expanded its use. You'll see here a chart, and this is our James setup chart. And this is where we actually will put the information update sheet. And Dr. Brad will be following me with talking about conditional logic. If you look into the patient's chart, the patient information update sheet, we have it down at the bottom near documents, and we have it up top so that when we go into this, you would click on this information. And you'll see it highlighted here at the top with your template choice. And once the sheet is printed out, this is what our patient information update sheet looks like. And as you can see, we have the patient's name and demographics at the top. We have their insurance information, their contact information. And then next you will see in the center of this that our records are indicating any items needed for health maintenance based on their age, sex, diagnosis codes. And at the bottom here, you'll see that we have their medications that are on our current list where we will ask if they need any refills, their allergies, also a section whether they've seen any other health care providers since their last visit, and what they're here for today. We take this sheet, and our son Aaron that still works with us, he's now in Orlando, he actually goes into all the patient's charts and prints our physician's schedule. And when the sheet is presented like this, this is his writings on here. He uses it to see if he's contacted a patient and also what items need to be done on the right. So how do we use this information update sheet at our practice? Well, like they had recommended before, we do print the information sheet about 5 to 10 days prior to their visit. Now, if our patients, we of course have patients that are added in the meantime from the time we print it, so our staff would then print that update sheet and have it ready for the nurse to review with the patient. We have our staff member, either myself or Aaron, has called the people that are coming in that we want to review if they have multiple items with health maintenance. We will write down, like you saw on the sheet prior, what items are needed, and then we will discuss the health maintenance with the patient and put down their response that we have. The health maintenance is discussed and updated in the chart, and we document under phone calls under health maintenance so we can track it. And there might be some other items that are on there that might end up helping the staff. So what we'll do, we'll write to the right exactly what they need to have done. For instance, if a patient needed a microalbumin and it was a procedure, the patient knows ahead of time that that's what they're going to have to be given us a urine sample, and the staff knows very quickly by looking at our sheet. So how is the information sheet used? Well, the first thing, after our sheet is printed, and you saw where we had made some notes on it, the information update sheet is used with the provider in the morning in a huddle. The daily schedule is gone over, and the information update sheets for each patient that is on that provider's schedule for that day will be gone over with the nurse and the doctor reviewing it to see ahead of time what they're going to be having done before they come into the room. Then the nurse will take or your medical assistant will take your sheet, and we used to hand them out ahead of time, but we found that a lot of patients didn't understand their medicines or they'd leave them sitting in our waiting room. So we have them when we actually put them on a clipboard and take them back with us. And then we sit and review the information on the sheet with the patient at the start of their visit, and we document in the chart what they're there for today and any other items of health maintenance that need to be done or any medication updates. We also go over their demographics, and we write any changes on there. Maybe they've switched emails, any contact people, any other information that we want updated. Then the patient is going ahead and roomed in the room with this, and the doctor will come in and review with the patient what has already been discussed previously with the patient, with the nurse, and the nurse with the doctor with the reviews. When the patient is finished, the sheet is sent back up with the patient for checkout, and our front will correct any demographics at the end of the visit. The patient information sheet is held for 30 days. Everything is documented off of the sheet, and it's shredded for a final disposition. So you ask, what are the potential information for a patient information update sheet? Some other things that you might want to consider having on it are advanced medical directives, maybe a next of kin on the sheet. Perhaps the patient has a caregiver, and you might want to get that contact information, or any other preferred method of notification. And also this is open for other ideas that you can add and change to your sheet. Now I'm going to have Dr. Brad talk to you about the conditional logic, and he will be telling you how to set this up.
Sorry, we had to switch the headset, so I apologize. And in fact, you may hear some clicking here, so as we switch over. It's good to talk with you today. I think Jan did an excellent job. She's our nurse manager and has sort of been a leader with this, and it's been really helpful to have her doing this. Let me go into some of the ways we've set this up. As mentioned earlier, this came out of the MS-TRIPS study. And as such, something else happened, which was the meaningful use through the HITECH Act of the American Recovery and Reinvestment Act. And so this really kind of fit well into that whole process. The things we're going to talk about today, and it assumes some knowledge of this, is the use of tables in creating templates, use of letter codes, insert codes, and conditional logic. As you guys know, that Practice Partner and, of course, LITECH and Metasoft, it's a note-centric EMR, which is really kind of how we've all wrapped our brains around documenting for all these years. But with these particular items, you can really use the power of the EMR to make it happen. The first part was really to create a section of the chart for the patient info update sheet. We did that in the lower left-hand corner. As you can see, it's number 4 on your program there, and this is the place where we park all of these info update sheets. This is kind of nice in a sense because it's a document that stays there, so that subsequently, if things change, we'll see those changes over time in cases of medications or whatever. So it actually is an archive, if you will. You do this with the chart setup and configurations. So the template is using tables, and the problem with templates and tables are that you have borders with them. This is great if you want borders, but frequently when you're setting up formatting, you really want to not have those borders. And on the EMR Village is actually a video that sort of demonstrates how you can create tables without the actual borders so that they're sort of transparent. And including that, with that is how you can do shading, which you've seen earlier with the separations of the different sections of the patient info update sheet. Just a sidebar here, F1 is your friend. Use the help section of the chart. It's very now become very deep and robust, and it discusses the use of letter codes and insert codes. And actually, a good thought that you might want to do is to take this section over here, if you can see the cursor, I'm assuming you can, and actually you have an option to print, and you could print this out as a paper document so you can have reference to the letter codes and insert codes, or even create a PDF which you can put on your knowledge base, which is the subject of another talk in great detail. So what we're going to do is we're going to break this out. This is the actual template as it appears when you're actually editing the template or creating it. As Jan mentioned earlier, there's the demographics section, and you can see, and we'll go over this in more detail, the insurance or carrier section, and then you can see all these letter codes which refer to contact information, and actually here's some conditional logic here. This is actually another letter code which says health maintenance not up to date. We'll talk about this. Insert codes, and again, we've actually created a flexible section down here for seasonal things such as influenza, just to help educate the patients while they're actually interacting with the sheet. Let's go over the top. As you can see, again, using the help and printing that out, you can refer to this. The first name, middle initial, patient name, date of birth. You can see all this. And this is kind of a new feature here. Let me talk about this. Patient-defined data is in that other demographic section that you see in the demographic tab or patient information tab. You can add anything in here. Of course, there's some of you who have moved toward meaningful use with language. This is one of those. And anything that you use in this section here can be using this bracket, in this bracket area here, the actual designation. So you can do any number of things. Another new 9.5.2 feature is the patient greeting, which is a long time in coming, but it's great. And this, let's say that, you know, in my case, my given name is Floyd, but I would prefer Tripp. And so, you know, my letters could actually have in it patient greeting. That might be helpful. And so if you actually keep track of this, if it's blank, the staff know to ask, and then they put it in the demographic section under patient greeting of the EMR. This will insert the first and second carriers and their insurance information, which sometimes changes. And here are some of the phone numbers that you can actually insert in here. One thing that you need to see here is conditional logic. Again, a new feature in 9.5.2 is the patient email, which is a long time coming. Everyone's excited to see this. And this uses the conditional logic. Let's go through that a little bit, although it's the subject of another talk on conditional logic, of course. But this asks if they have a patient email, which is greater than empty, those are two quotes, then that would be something that has content in that field, and it would put their email in there. Otherwise, or else, it puts this blank, this line and at, and the second line, primary email here. It inserts all of that. And as you can see here, perhaps, there's the bracket, and there's the other bracket. And, of course, the double types closes out this conditional logic. And that's the first and upper part of this patient info update sheet. The middle part uses health maintenance, not up to date. I will say that Steve Johnson with Steve Ornstein at Price Partner Research Network has really flexed the use of this after we came out with this. And actually they have conditional logic that will ask questions about specific health maintenance items. But this is the one that will list everything on that particular patient that's not up to date. And then you can see, of course, these are the shaded sections which you can actually format. And it's in the EMR Village. And then here's the list of your current medications, need a refill, and of course it inserts the current medications. Your allergies, again, these are insert codes. .ial inserts the allergies, and it'll list everything. And of course this explains maybe why we might have NKA or NKDA as no known allergies. And of course, as Jan mentioned earlier, sometimes it's good to have the patient make comment on anything that's been done so we can either chase it down real time during the visit or subsequently to fill in the database later. And here's an important thing. This is what are you here for today. This takes the oh by the way statement at the end of a nice long visit. Oh by the way, can you check my big toe? It's ingrown, or whatever. It actually helps sometimes to put that on the front end of this. The conditional logic is down here, which we talked about earlier, which is seasonal. This asks if health maintenance influenza vaccine, gives the date, equals blank. Again, if it's empty, then this actually prompts them to do that, to just notify them that this is anyone over 6 months of age, and else it'll print in their last influenza shot. And sometimes, again, they've had that, but at least it gives you a date, and this was your last influenza vaccine. So, again, we can change, you can change this seasonally. A point that I need to say is that this is really packed into one page. It's designed to be on one piece of paper, but as you might gather with health maintenance or medication, sometimes those lists get long. As you know, these particular items get inserted vertically, so you can't, for instance, put 2 cells in a table to put maybe 10 medications and another 10 medications. It'll list all 20 down vertically, and sometimes it spills over into a second sheet. But that'd be your opportunity to sort of say, look, you're on a lot of medicines, let's cut out some of those. Okay, so those are some of the things. Of course, we've talked about this already. The conditional logic, as I mentioned, this is actually how it prints out. When you're looking at, if you print out the template, looking for these particular items, and again, it'll print out basically a line which allows them to put their email in and sort of helps guide them. And here's some of that health maintenance, or the health maintenance conditional logic as mentioned earlier. An important point, and something that many people don't realize, is that the note templates are organized on the lookup based on alphanumeric characters and non-alphanumeric characters. Spaces are considered at the top. Then you have non-alphanumeric characters such as dollar signs or a period or whatever you have, and then you have numbers and then the alphabetical organization. So in this case we have two spaces, which puts this right at the top. Dr. Pegas actually put his requisition here at this point, and then it puts it at the top for him, which is great, but we, of course, subsequently dropped it down. But there's one space here for our requisition for our lab, which we're still using. We used to use it, rather, and that's still up there. But then we have our requisitions that we use as templates, too. As we move over to order entry, those will go away. But don't forget to try, if you like something to always be at the top, always chosen, that's real helpful if you ever consider using any macros to print out things. You won't have to have it spaced down to find it. So one of the things that Jan mentioned and alluded to and went over very well was, the use of templates and the node-centric templates and all the logic really helps you be a very powerful user of an EMR, and all these things make a big difference. The templates, the letter codes, insert codes, the dot codes, and conditional logic create wonderful processes where you can actually do this. The patient info update sheet is just but one example. You use other add-on programs and, such as Macro Express. You use your end-user community, which is probably the most robust in the nation in terms of EMRs. And then the most important thing, obviously, is your imagination. That imagination, when shared with others, has created wonderful innovations. As Jan alluded to, Plymouth Family Practice created this whole process. Steve Johnson has taken the patient info update sheet to new levels, and in fact, has actually been noted by the Agency for Health Research and Quality as a exemplar of process. In fact, and again, we're hoping that we can show you the YouTube, but there's the YouTube, excuse me, URL above, and this was the actual article that was written and funded federally by ARC, or AHQR, implementing and evaluating electronic standing orders in primary care practice. This was a study utilizing standing orders for such things as immunizations, radiology studies. This was actually part of a poster that we actually had in our office because it mentioned here the fact that the patient info update sheet was used. And, again, by allowing our staff to realize that they're actually involved in processes that make a difference just beyond our practice and perhaps nationally, it's really activated them to some extent. I'm going to click on this. Well, it doesn't appear to be working, but McKesson will probably play this, and at that point it can be viewed. It's a very inspirational video to see how one practice in Connecticut has really made a difference. Steve Johnson, again, another end user who's a real innovator, has made a big difference in further launching other innovations and ideas by other users. I'm going to pass this back to Jan and let her finish out the talk. Thank you for your time, and here is Jan. Just give us a moment to switch over the headset.
Thank you, Trip. You'll see here that with our patient information updates that we have a lot of resources that would help you with this if you're interested in checking them out. The first one is the EMR Village at www.emrvillage.com. On there it has videos and one on the patient information update sheet, file sharing site, and blogs. Also, the Practice Partner Listserv, the connection through EMR Village, PPRnet through www.musc.edu/PPRnet. Practice Partner Forum also is another place you might want to check out. And also TransferMed, the Delta Exchange at www.delta-exchange.net. And I also wanted to mention, when I spoke at the user group meeting in McKesson, one of the things that we felt was very important with pre-visit planning was the whole idea of sort of front-end loading. And I think maybe after listening to this, you'll kind of understand that better, that we try to do as much as we can to take care of our patients with their health maintenance, immunizations, things that are needed, and just keeping on the same page, so to speak, with our patients. So trying to do as much as we can prior to the visit with pre-visit planning. We also do something beyond this. Aaron, who does work from us from Florida, we track all of our patient information update sheets. Every time someone comes in, we go into that section and print out a new patient information update sheet. So it will be stamped with the date that we actually print the sheet or that we make the contact with them. And we do keep track within the subjective part of their template. When we put what the patient is coming in for, we also list our health maintenance items, and we list this on a sheet. He does an Excel spreadsheet that actually will show us potentially how many people, for instance, within the week per provider, how many of their patients are eligible coming in that have not had the flu vaccine that might need them, or any other health maintenance items that are needed. And then we tally these to see, how well we have done. Of course, we have the provider close the loop by making sure at the end that before the patient leaves, if for some chance that we haven't done, for instance, an immunization prior to the visit with the physician coming in the room, that the nurse has not done that already, or your MA, that we have picked that up at the end. So really trying to take good care of our patients, and I really feel that this tool, the patient information update sheet, really helps us with all of the guidelines that are listed with the patient-centered medical home with pre-visit planning. If you have any questions, we would be happy to speak to you at any time. The $500 is something that McKesson had used kind of monopoly money for the talk, so that's why that's at the bottom there if you weren't at the user group meeting.